Anxiety, a term commonly used to describe feeling stressed out or worried about a particular event. Although many people use the term feeling anxious on a daily basis, it is a slight misuse of the term. Let's take a look at what these strangers think generalized anxiety really is. How do you define anxiety?
I would say it's an overreaction to everyday things that shouldn't be stressful or considered anxiety provoking.
Okay. What's your definition of anxiety?
I would say excessive worrying about everyday things that might not really be as big a deal as you think they really are.
Anxiety is actually a condition characterized by excessive worry or apprehension and the lack of real or obvious danger. It can lead to impaired functioning and personal distress. Some anxiety is a normal reaction to stress and is helpful in some situations like this.
Man, I'm nervous for my first day of classes. I hope I can find the building. I wonder if the teacher is nice. I hope my friends are in this class. Well, here goes nothing.
For some people, though, anxiety can become excessive and negatively affect their day-to-day living. Let's take a look.
I'm nervous for my first day of classes. I hope I can find the building. I wonder if the teacher's nice. I hope my friends are in this class. What if everyone hates me? I can't go. It'll just be better to stay home.
We've just seen some typical and atypical responses to generalized anxiety. Coming up next, we'll view some commonly used treatments to treat anxiety and its symptoms. We'll be back after this commercial break.
Are you feeling unexplainably nervous? Do you have a constant feeling of worry or dread about minor events? If you answered yes to either of these questions, then chances are you have generalized anxiety. Luckily, we have a treatment for you. Introducing a new prescription drug. Side effects may include, but are not limited to, nausea, blurred vision, headache, confusion, tiredness, nightmares, drowsiness, dizziness, unsteadiness, problems with coordination, difficulty thinking or remembering, increased saliva, muscle or joint pain, frequent urination, blurred vision, changes in sex drive or ability, rash, hives, swelling of the eyes, face, lips, tongue, or throat, difficulty breathing or swallowing, hoarseness, seizures, yelling of the skin or eyes, depression, difficulty speaking, thoughts of suicide or harming yourself, difficulty breathing.
There are many ways to treat your anxiety, but at what cost? Although pharmaceuticals can be effective, they are expensive and can have unwanted side effects. Therapy can also be beneficial, but is just as costly as the pills. What if I told you there was a better way? A way with minimal cost as well as additional health benefits? Does this sound like an ideal way to treat your anxiety? Are you dying to find out what this magical treatment is? No, it's not a magic pill or a secret elixir. In fact, it's something that is free to everyone, but is greatly underutilized. What is it, you may be asking? It's exercise. Let's see how physical activity and exercise has helped these people with their
I have
anxiety.
terrible anxiety until one of my friends asked if I would start going to the gym with her. I love being able to catch up with my friends and improve my anxiety through socializing. I feel great and my friendships are stronger than ever.
I started working out to improve my personal fitness. I realized that the more fit I became, the better I started to feel. The more I exercised, the less anxious I started to feel, and it made me feel better.
I started going to the gym to relax after a long day of work. Exercise allows me to forget about the stresses of everyday life while I work out. I found that my anxiety has been way lower since I started exercising because I can take the time out of my day to stop stressing and just enjoy the gym.
If you don't believe us, just look at this study done by Brooks in 1998. Brooks was trying to compare exercise and prescription drugs as treatment for patients with panic disorder. He took 46 participants with panic disorders ranging from moderate to severe. He then randomly assigned them into one of the following 10-week programs. He assigned them to an exercise program, which was running 3 times per week, a pharmaceutical intervention, which was anxiety medication, and then he had a placebo group. After the 10 weeks, he found that anxiety symptoms equally improved in both the exercise and the pharmacology groups. One key finding was that with the exercise group, it does need to be anywhere from 8 weeks to 6 months long. So basically, the longer the program, the more effective the treatment is.
Well, there we have it. A quick look into anxiety and the effects it could have on a person's daily life. Anxiety is a major mental health issue that can greatly affect someone's day-to-day living. There are many ways to ease anxiety, but physical activity has a better overall contribution to a person's health, with numerous studies and interviews to prove this point. Exercise can also help avoid the costs as well as the side effects caused by pharmaceuticals. So, if you or a loved one are suffering from any of these symptoms, go see someone for help and see what the additional health benefits of exercise can have for you.